Good morning, everyone. A very good morning and a very healthy, happy day because it is World Health Day today. And I am joined by Dr. Jyoti Wadhwa. Thanks for joining us today, Doctor. She is the Director in Department of Medical Oncology with Medanta, the Medicity Hospital. And she has also authored a book on breast cancer, which is titled Fear, Facts and Hope.
True.
So the reason why we chose the topic for this particular day is this is one topic where even I have found a lot of people fearing the mention of the name of the disease. So such dread and even the hesitation to talk about a topic like this leads to a lot of myths about the disease and a lot of beliefs that are not true. So I'm hoping that this conversation can debunk a few of the myths for our members today. So thanks for joining us. So the first question will be the fear factor that surrounds this entire the various types of cancer is that do all cancers lead to death, doctor? Is it a death sentence?
So hi, Gurgaon moms, and I'm very happy to be interacting with you all today. And it's my pleasure indeed. And I would definitely like to share my knowledge about this disease entity so that you all feel empowered and can tackle the situation if at all it arises in your life. So cancer earlier used to be thought of as a death sentence, but no longer, because with advances in the treatment strategies, we have really conquered this problem. And many of the cancers are now curable, and treatment is possible for majority of patients.
Okay.
So it's very important to know that even though the cancer may be in stage 4, it's still treatable. And a lot is possible.
Is also treatable.
Yeah, so the last stage, so-called last stage, stage 4 of many cancers is very well treatable with gratifying results now.
Okay.
Because we now have personalized treatments for cancer wherein we personalize the treatment, anti-cancer treatment, as per the patient's tumor.
Okay.
So it's no longer a death sentence, and one need not be so pessimist and hopeless. There's a lot of hope.
Okay, so treatment is available.
Yes, treatment is definitely available.
So is it a lifestyle disease, doctor? Because we often hear a lot of people saying that probably it's because of the new lifestyle, the new dietary habits, or the new sedentary lifestyle that most of us lead that cancer happens. So is it because of the lifestyle?
Yes, barring 5 to 10% of cases which are due to inheritance of abnormal genes, rest of it, most of the cancers are lifestyle related. So just like diabetes, hypertension, heart disease, stroke, cancer is also a lifestyle related disease.
Okay. So you just mentioned about this abnormal gene. Now, is there a way to test even prior and to find out whether a particular individual is a carrier of that gene?
Sure, yes, it's definitely possible, but there are some indications, each and every one of us need not undergo that genetic testing because it's associated with a lot of anxiety.
Mm-hmm.
And one has to be very clear in the mind before doing the genetic test as to what you are going to do next if you are found positive. So there are definite indications, say in breast and ovarian cancer syndromes, we have BRCA1 and 2 gene mutations, which are very commonly ordered.
Mm-hmm.
But even for those, there are definite, indications. Not each and every breast or ovarian cancer patient be subjected to it.
Okay. So a doctor will probably
meet your doctor.
Okay.
And after talking to you, after taking the family history in detail,
there are several doctors. Like I meet a gynecologist, I meet a dentist, I meet a general physician. Who will be the right doctor to give me an advice on this?
So a good physician could be the first starting point. If you have access to oncologist, say a medical oncologist, that would be the best.
So, doctor, again here, I'm sorry to butt in, but when you mention oncologist, do a patient or do a person meet an oncologist only when detected with cancer, or even as a preventive measure, can we go and meet an oncologist?
Yeah, you must be aware enough to seek the opinion even before a diagnosis of cancer is made. So that's the whole purpose. Today, it's most important to prevent cancer, isn't it? So it's best to seek the advice when you are still so-called healthy, especially if you have any family history of cancers. Go to oncologist, go to a good physician also to begin with, and share your details, and if need be, undergo the recommended screening test. So screening test is in fact applied to those individuals who are not yet suffering from any disease, and they are fine, otherwise they are healthy, and we want to look out, for cancer.
How often and after what age should we start doing these tests?
So for men and women, there are different recommendations. There are no definite guidelines for Indian population. We follow the Western guidelines. So say for breast cancer screening, each and every woman after the age of 20 must examine the breasts every month, just a day after the periods get over, so that one is aware of as to how her own normal breasts feel. Once in a year, one should undergo clinical breast examination by a doctor. Now that doctor could be a general surgeon, could be a gynecologist, could be oncologist. So once in a year, clinical breast examination. Starting at the age of 40, one could undergo mammogram, and along with ultrasound of the breasts. If there is a family history of breast cancer or ovarian cancer, then one could use a modality like MRI of the breast also, and at an earlier age.
So you keep mentioning about family history. In fact, when we posted about this live chat in the community as well, there were 2 or 3 questions on that particular topic. People with family history, what are the chances that somebody in that family line will get it?
So it depends on who in the family is affected with cancer. So say you have a mother, father, brother, sister affected with, say, breast cancer, then the risk is very high. So we say the relative risk is more than 4. So you are 4 times more likely to develop breast cancer than the general population. But if a distant cousin, say, so we classify it as first degree relative, second degree relative, or somebody else, distant relative, and closer the relationship, higher the risk of developing that disease. Yeah, so one needs to be more careful then.
So you did briefly mention about how we should, what are the different things we should do, measures to take to prevent cancer. Now we keep hearing about the superfoods to prevent cancer. So what are these superfoods? Are they really helpful, and how should we be consuming this?
So the basic principles to be followed for cancer prevention are quite simple actually. So if we talk just about the diet, it's recommended one should eat balanced diet, which should include at least 4 to 5 servings of fresh fruits and vegetables every day. Every day. So that should be good enough, combined with regular physical exercise.
So again, they have these organic fruits and the normal fruits that we get. Do they make a difference? Does it really make a difference?
So it's not yet proven that organic is definitely superior to the otherwise available fruits. It's good to be aware that pesticides and all these sprays, and now more often we get to hear that vegetables in particular are grown overnight by injecting hormones. So in fact, those hormonal injections may be more harmful. And like non-vegetarian stuff like chicken also being infested with not only antibiotics, which don't affect our disease and entity that we are discussing today, but hormones are also used to make make them grow better and bigger. So that's a matter of concern, because many of the cancers, say breast cancer, endometrial cancer, prostate cancer in men, are hormone driven. So it's very important for us to be aware that we avoid all this. So
and what about the superfoods, doctor? Like we keep hearing about the goodness of turmeric or
turmeric. Yes, the association of turmeric, the active ingredient in turmeric being curcumin. So that has been proven in research done at MD Anderson Center in US to be anti-cancer.
So our Indian system of adding turmeric to
is very good, and we must retain that.
We must retain.
So yeah.
Okay, great. So doctor, cancer, we know that some of the cancers are also caused by virus and bacteria. So is it infectious?
Cancer is not infectious. So if somebody is having a family member affected with cancer or is looking after a patient of cancer, one will never contract that cancer from the patient. But cancers, some of them are definitely caused by infections. Say the cervical cancer in women is definitely linked to human papilloma virus. And the liver cancer, hepatocellular carcinoma, is definitely linked to hepatitis B and C viruses. Similarly, there are some leukemias, blood cancers, and lymphomas, which are linked to Epstein-Barr virus and HTLV1 and HIV.
Okay.
So that way, they are a known causative agent, but cancer per se is not contagious.
Okay.
It doesn't spread from one person to another.
Okay. Now, I do have a question here. Okay, so we spoke about superfood. Now, so moms always like, you recommending 3-4 items that we can probably add to our kids' diet, so that to ensure that they stay healthy. So one that you mentioned is fresh fruits. The second you mentioned is turmeric. So are there any other food items that we should include on a daily basis in order to ensure that they are protected?
Yeah, sure. So one should make sure that there isn't too much consumption of refined food. One should restrict the use of, say, maida and other refined flour. One should try and stick to whole grain things. And the content of fat, especially the saturated fats, should be up to a limit. One should try and consume, in addition to fruits and vegetables, nuts every day. So all the badam, akhroat, kaju, kishmish, and others, whichever, depending on what you have available, you must try and consume them on daily basis. Then there are some seeds which are, said to be having some higher levels of antioxidants and therefore cancer protective. Some things like flax seeds, chia seeds. So depending on your pocket, one need not go and go out of the way to procure them, but try and eat sensibly and healthy. Be conscious of what you are putting in your mouth. That's it, and don't just binge eat and eat junk food blindly and too often.
Okay, so I hear you. So you're saying introduce more amount of whole grain food, introduce fresh fruits, nuts as well, and basically food which is high on antioxidants.
Yes, great. And turmeric is great. Green tea is also good.
Green tea
is
antioxidant as well. Doctor, the other question which we often find in the community and we do not have a very clear answer, we never got a clear answer, is cervical cancer. And in fact, another member has also raised the same question. So is the preventive vaccination for girls, is it recommended, number one? Number two, does it serve its purpose? And until what age is it effective?
So cervical cancer vaccine is available, is recommended. And the ideal age is between the age of 9 and 26. 3 shots are required, 0, 1, and 6, which means if you take 1 dose today, second dose after a month, and third dose after 6 months from today. So 3 doses and you get significant protection against cervical cancer. But that doesn't mean that if you are vaccinated, you can just be laid back. You still have to undergo pap smears and HPV testing.
So, is there anything which has got to do with the hygiene factors? Do they affect
cervical cancer is definitely associated with the poor sexual hygiene. So that's why the association is there with the non-use of condoms, especially if the partner is already infected with HPV, multiple sexual partners. So it's very important to maintain good sexual hygiene.
Doctor, another thing which I keep hearing, and I would want to hear from you whether it is a myth or not, is I have been advised not to use deos, which has parabens and anti-perspiratory agents. So is that true that deos can cause cancer?
So antiperspirants and deos are 2 different things. So antiperspirants are unhealthy. Why should you and why would you want to not perspire? It's a natural healthy phenomenon. So strict no to antiperspirants. Deos, there was some concern earlier for use, especially if used directly over the skin, underarms, after waxing or shaving. So that should be avoided, I think. Because these links, it's very difficult to prove the direct associations often. And you need to do a very long-term study in a large number of women before you can definitely document. But it's a great idea not to, apply things with known carcinogens directly on your skin.
So is paraben a known carcinogen?
Paraben is unhealthy.
Is unhealthy.
Yes.
Okay. Doctor, another thing is, yes, we spoke about the diet largely. Now, talking about lifestyle and the active lifestyle, non-active lifestyle, most of us lead sedentary lifestyles, we're stuck before our laptops. So, does being overweight, does it contribute to more chances of getting this disease?
So I won't say overweight, but obesity, yes, is linked to many cancers. It does increase the risk of, so if obesity after menopause is definitely linked to higher incidence of breast cancer. Obesity otherwise is associated with higher risk of endometrial cancer, prostate cancer, and some other like pancreatic cancer. So obesity is not good, and the associations are indirect, but they are definitely proven for the cancers that I mentioned.
Okay. Now we have a question from Monalika Sabarwal. This again is a topic which is often discussed in the community, and it'll be lovely to have some clarity on this. Is that we hear microwave is dangerous and cannot be healthy, and it can also develop cancerous cells. How much of this holds true? And use of glassware instead of plastic in microwaves, do we make it safe then?
So plastics are strictly not to be used in microwaves. Glassware, each and every glassware is also not suitable to be put in microwaves.
Okay.
So there are definite microwave compatible utensils, the quality products which are available, that only should be put in the microwave. And microwave use, the association with cancer is not confirmatory yet, but it's good to, stick to our traditional ways of cooking. But in emergency, you could use microwave, say for heating, you could use, but not. I would not recommend as personally
As a
to use
daily
it for daily thing, for cooking the whole dish.
Right.
Using it for 30-40 minutes. But heating stuff once in a while, it's okay.
So let's not make it a routine, but let's just use it as...
For routine cooking, stick to your traditional, gas and stove.
There's a question from Nitu Puri. Does side effects of radiation and chemo stays forever after the treatment?
That's a good question, and the answer is yes. Sometimes, depending on the dose of radiation used, the body part irradiated, the effects can sometimes be long-term. And radiation itself could also be a cause for cancer, especially say breast cancer if the chest wall has been irradiated. Chemotherapy has some long-term side effects. It can affect the fertility. It can affect the heart in long term, depending on the dose and the drugs used in particular, can suppress the bone marrow function. So they do have long-term side effects sometimes, but usually not.
So one of our members have mentioned she has PCOD for the last 5 years. She has sleeping ovaries. And can this lead to ovarian cancer if not removed, as the medication is not helping her? So what do you recommend, doctor?
Okay, so polycystic ovary disease is associated with hormonal imbalance. And the association of it is with increased risk of endometrial cancer. And there's no direct association with increased risk of ovarian cancer or breast cancer. But the link could be indirect, Most of the PCOD patients are obese. And obesity, we have learned, is itself a risk factor for many of the other cancers.
Right.
So that way, it could increase someone's risk of other cancers besides endometrial cancer. But the association is not clear and direct with ovarian cancer.
Okay.
But endometrial cancer, yes, PCOD can increase the risk of.
So this is exactly the place where, again, a lot of us have doubts. In fact, I was just talking to Kabira as well. So now this patient, she has a problem, and which will be spoken and dealt by the gynecologist.
Right.
But so whom does she meet for a clarity on this topic? Should she just meet the gynecologist and be happy, or should she go ahead and meet an oncologist and also ask for clarity?
So gynecologist should be able to answer
Guide.
all her queries, and all the fears could be allayed. And obviously she should be treated well, and then has to be alert enough to be aware that yes, there is some increase in the risk, and therefore if there's any symptom later in life, she should not delay seeking a doctor's opinion. So one has to be aware basically, but gynecologist is good enough to be tackling this issue.
Okay, great. Okay, we have one more question about, okay, there are two different questions. I'm going to club that. One is on air pollution. Can air pollution eventually lead to lung cancer? And the next question is on the usage of non-stick pans. Are they harmful? And
So first question, so air pollution. So
yes.
you may be surprised to know that air pollution is also declared a carcinogen, which means it's a cancer causing agent.
Oh, God,
So a few years ago, WHO, in fact, the International Agency for Research on Cancer, IARC as we call it, has declared air pollution as a cause for cancer.
I think that's all the more reason for government to take this on a war footing. We live in a city which is...
And that's why, we are never sure as to why we are seeing more patients with lung cancer. And this could be one of the reasons, who knows? And one can't be proving each and everything in your patient population every time. But air pollution is a known carcinogen and one must try and protect oneself from it in every possible way.
God, okay.
Yeah.
And about this non-stick ware,
so non-stick is, if in good condition, undamaged, is fine. But often we see that because it's difficult to maintain them in good condition, they need a lot of care.
Okay.
If there's a breach in the film, then the metals and other chemicals could leach out from the base, and that is what could be harmful. So if they are intact, if the film is intact, it's good.
Okay.
But otherwise, if there's a breach, don't use it.
Like they say, use it for 6 months or 8 months and then...
Yeah, so if there are, you see scratches in it, don't use it.
Okay. I see, okay, this question has been repeated twice, though this was discussed initially. So I'll request you to briefly touch on this. Is cancer genetic? Doctor mentioned yes. And if in a family, there have been any family member, previous generation affected by cancer, should we be worried and get regular checkups done? Doctor did say yes. I will request you to later check back on the FB Live where she has answered this particular question. Since I have a few more questions and we're running out of time, I'll just ask you these quick questions. Okay, now ovarian cancer again received a lot of questions. So does it have symptoms in the early stage? And if yes, what are the symptoms?
Ovarian cancer is often diagnosed in late stage. And it's because the symptoms are very non-specific,
Okay.
So some symptom like bloating, lower abdominal or pelvic discomfort or pain, frequency of urination, increased frequency of urination. This is all that it could, present with.
Okay.
So it's often difficult to, attribute this and think of, ovarian
These
cancer.
Again are often associated with other medical conditions.
Things, like it could just be pelvic inflammatory disease, some infection there. So if you have any of these symptoms, it's wise to, see a gynecologist.
Even before periods,
so that's okay. So bloating and, pelvic discomfort, yes. So, if there's a recent change and if this is a new symptom that you have noticed, then you must go and seek gynae opinion.
Can cancer come back once treated?
Yes, cancer can come back once treated, and therefore it's very important to be on follow-up and initially more frequently, and then, annually. One should always be on regular follow-up.
And okay, so does drinking alcohol increase my risk of getting cancer?
Yes, alcohol is also associated with development of many cancers. So it can start with, oral cancer, cancer of the mouth, then food pipe, liver cancer, breast cancer is linked with alcohol intake, and in men, prostate cancer. So these are some of the cancers which are definitely linked with the alcohol consumption.
And so there's a mom who's also thanked us for the replies. She says as a mom, she's worried about the next generation because the kind of pollution, be it water, air or food that we're seeing around us, it is very worrisome.
Yes, I would fully agree. And I also wish that the government takes more, corrective measures, because we are breathing all the time and we can't, not breathe. And water is so important. And in fact, as doctors, we keep telling drink more and more water. But if that water is not safe, then you will definitely end up with diseases, heavy metals in water. And there are so many concerns. So I think government does need to do at a large scale, do something about it.
I think this has
and
to be
these
done
issues,
on a war footing right
health
now.
should be a priority for the government. Because, healthy individuals only will make a healthy nation. So
Thank you so much, Doctor, for your time.
It was pleasure interacting with you, Neela.
Yeah, and I think it was an eye opener on a lot of questions. We will keep having more questions, so we will definitely come back to you.
Most welcome.
Thank you so much for your time. We would also like to thank Getwell Oncology for taking this healthcare initiative in promoting awareness on the World Health Day. Thank you so much for joining us.
Take care. Bye-bye.